Okay, I will be administering some IV medications. My patient is Shane Schroeder, and he presented with a GI bleed, and I will be giving him Pantoprazole. I've already done my first check, which is comparing the physician's order sheet with the MARS. So my patient here, Shane Schroeder, date of birth November 1st, 1968. Dr. J. Ames, FIN number 0991749. So he has allergy to morphine. The MAR has been double transcribed, and what I have here is Pantoprazole on the parenteral drug monograph. It is ordered 40 milligrams of it IV, and then for IV reconstitution, it is supplied as a 40 milligram vial. I need to add 10 mLs of normal saline for a final concentration of 4 milligrams per ml. So I will now wash my hands. I will wash my hands, and what I have here is Pantoprazole, and then given 40 milligrams. It is for IV, and it is not expired. And I will also need to get my normal saline, which is right here, and it is also not expired. So now I will need 10 mLs of it, so I've gotten a 10 ml syringe as well as my blunt fill needle. So I will now, here's my Pantoprazole and my normal saline, so I will...
my first check. So, my patient is Susie Sanchez.
Swab for 30 seconds. And let it dry for 15 seconds. And I will also get my normal saline, which I will swab for 30, dry for 15.
So that is acceptable.
So he needs 40 milligrams of it.
For intravenous use. And my time is every 12
hours. So I need to add 10 mLs of normal saline. I will wing it back, 10 ml syringe, making sure it's sterile, and I will get my blunt fill needle as well.
Done my first check. Next thing I'm going to do is pull out my parenteral drug monograph and just verify a few things. So first of all, this can be administered by a nurse.
So I will pull back 10 mLs.
This is a vesicant or irritant. So that's
I've already swabbed my normal saline, and I will now inject it in.
Okay. Alright, excellent. So my usual dosage for maximum
10 mLs of air.
is 3 grams.
I will
pull
it back.
My doctor has ordered 500 milligrams, so I know I'm within a safe range. And my maximum daily dose is 6 grams. This is Q12 hours, so we know that we have a safe situation here. Now for reconstitution, I have to do so I have a 1 gram.
I'm going to get rid of all my air bubbles.
20 ml sterile water for injection. And then I'm ready. And again,
there's no air bubbles.
And 20 mLs of sterile water.
There's now no more air bubbles, and I will now put it into my Pantoprazole. Should I show the camera?
I'm going to do that as well with my sterile.
Here it is, 10 mLs of normal saline. There's no air bubbles. And now I will get my Pantoprazole, put it in. It's been swabbed already. Inject it. And then I pull back 10 mLs of air as well. I accidentally pulled it out, but I didn't put it back in, so it didn't breach any sterility because the needle didn't touch. Now I'm going to scoop and swoop, and I'm going to now give it a roll for 30 seconds. And that mixes it, and now after I rolled it, I'm going to get my alcohol pad, and I'm going to swab for 30, dry for 15. It is 4 milligrams per ml. He needs 40 milligrams, therefore I need to get 10 mLs of it. So I'll now pull my needle back to 10 mLs.
So I'm going to take this.
And now I've already re-swabbed it, and now I will cap this. I will inject it, and then I will inject the air. Turn it over.
So I have 3.4 mL. So water in here is quick method so that we don't poke ourselves.
have a little bit less than 10 mLs, but that is okay because I couldn't get all 10 mLs. But now I will cap this. And I can show the camera that there's no air bubbles. There's less than 10 mLs. And now I will write a label for it. So, in my label, this is for Shane Schroeder, and this is Pantoprazole given IV, and the dose of it is to give 40 milligrams of it, and the volume 10 mLs, and I've chosen a 100 ml mini bag because patient's not on fluid restriction, so that makes it 110 mLs, and the diluent of it is going to be normal saline, and as per Monograph, it's compatible with normal saline, and the concentration would be 40 divided by 110 would be 0.36 milligrams per ml, and the right time to give it is October 19, 2021 at 1300, let's say, and then given by me, HYL, University of Manitoba student nurse, 3rd year. So here's my pantoprazole, and now I will do my second check. So I have here right patient, Shane Schroeder, right medication, pantoprazole IV, pantoprazole IV, pantoprazole IV, pantoprazole IV, and pantoprazole IV, right dose, 40 milligrams, as per the Monograph, it's 40 milligrams at 10 mLs normal saline, and then what I have here is 10 mLs, and right route is to give it IV, and this is an IV infusion, and this is the IV infusion, right time to give it is to give it daily on October 19th at 1300, has not been giving it, I will be giving it. And here's my label as well, showing the right total volume, 10 mLs from my pantoprazole syringe plus 100 ml vial. So here it is, and now what I will do is, here's my mini bag, and I will...
So I know that I can administer this safely. I've got an IV Q 12 hours. So again, this is IV. It's Q 12 hours. It has not been administered today, so I'm good to go. All right. So I have my vancomycin here, and I am good to...
I will swab it for 30 seconds and let it dry for 15 seconds.
With the date of birth.
Swab for 30, dry for 15, maintain sterility,
So,
and I will
next thing I'm going to do is get into my parental drug monograph. I got my vancomycin. So there's a few things I want to note. First thing is that this can be administered by a student.
And now I will cap this.
This is a vesicant or irritant, so it's important to
And
know.
I will give it a gentle shake to mix the medication. And now what I'm going to do is also put my pantoprazole.
And a maximum weekly dose of 6 grams. So again, I've ordered...
Is I'm going to stick this to the mini bag.
Alright, so I have a 1 gram vial per supply here, and I need to be adding 20 ml of sterile water per injection for a final volume of 20 ml.
And now I'm going to have my mini bag, my secondary tubing, and I'm also going to have my pen, as well as my MAR and my Monograph. I would put all these vials away, and I'm also going to get myself these alcohol pads. So I enter the patient's room and I do my entrance safety check. Patient's bed's in lowest position, call bells within reach. He's not in pain and distress, and there's no fall hazards. Hello, my name's HongYang Lin. I'm a U of M student nurse here to give you your medication, your pantoprazole. Can I take a look at your wristband? So I see here it's Shane Schroeder, Finn, and 099, 1749, date of birth, November 1st, 1968. Great. Sir, can you please tell me your first name and last name? Can you please tell me your date of birth? And do you have any allergies? No, he does not have any allergies. And now what I will do is I will do my third check. So I see here Shane Schroeder. right medication, pantoprazole, dose 40 milligrams, and it is in 110 mLs of concentration, because 10 mLs from the syringe and 100 from the mini bag for a final concentration 0.36 milligrams per ml. Route is IV and IV daily, given now on October 19th at 1300, has not been given yet. Another safety check I make sure is I look at the patient's PIV site, and it looks intact. And there's no phlebitis or drainage, and the site, when it is palpated, when I palpated it, it's not warm or cool to the touch. Mr. Schroeder, I will be giving you your pantoprazole for your GI bleed and your stomach upset. Side effects of it is it may cause some vomiting and dizziness. I've already assessed your IV site. Do you wish to take your pantoprazole? Yes, he does. So now I'll wash my hands, and I will get my clamp out. And with my clamp, I will drop the primer
I'm gonna aspirate
to
this
be
with
lower than it
3.4
is.
mils of air. So 3.4 mils in there, and then we're now gonna aspirate the sterile water with that air, and then just get our water out.
And then the next thing I will do is my roller clamp is fully closed, and now I will spike the tubing, making sure there's sterile technique throughout.
So I have 3.4 mils of sterile water.
So I've spiked the tubing,
Scoop method so you don't poke yourself.
and my clamp is closed, and now I will hang it on here. And with it's closed, and now I will swab the port that is before the backstir, because I want the backstir to control my medication, my primary port. So
Let dry for 15.
I will now, here's the port before, I will
Mix it with our sterile water.
swab for 30 and dry for 15. As I maintain sterility, I'm going to also
So you want to
unclamp
roll
this,
it, you don't want to shake it.
and now I'm going to attach it using sterile technique.
Especially with the IV medications.
I didn't swab for full 30 seconds, but I verbalized swab 30, dry 15, and now it's attached. I will now back prime it, so I will hold it below the level, and now I'm going to back prime to get rid of air bubble.
My calculations prior already. So the next thing we are then gonna do, I'm just gonna clean this again.
There's no more air bubbles. I better close the roller clamp now. So now I will hang it up, and now what I will do is it is currently infusing. I will hit stop, secondary. So what I have here is my rate. I'm gonna run it at a rate of 110 mLs per hour. And then my volume to be infused is 110 mLs. Callback is going to be yes, and then I'm going to confirm secondary, and then I'm going to open my secondary roller clamp, and then hit start. So currently it is now running. I'm looking. I want to see 3 drips.
Stick that
1,
on the syringe. So here's the label.
2,
And then we're gonna get
third
started
drip.
with our second
And there's-
shot, sorry.
oh, there's my third drip.
With the label and with the
There's my
bottle.
third drip. My backstir, it's running properly. There's no kinks in the tubing. Here's your call bell, sir. Please call me back if you feel any pain, irritation, discomfort at your IV site. I'm gonna do my exit safety check, which is making sure beds in lowest position, call bells within reach, patients not in pain and distress. There's no fall hazards on the floor. Document on my MAR as well, given on 1300 by me, HYL, University Manitoba student nurse, 3rd year. I'm not gonna actually document, I don't want to ruin the paper. And then I've also programmed, so I did my exit safety check. I've also programmed a callback, and I've also programmed a 15 ml flush out of my primary to infuse at the same rate that my secondary was infusing at. And this 15 ml flush, I've programmed the callback to call me back so I can see my mini bag has fully infused and that my primary is doing the 15 ml normal saline flush at the same rate that my secondary was going at. That way the patient can get all of his medications.
For IV intermittent,
And that is all.
250